Hello, my name is John Tsai. It's my pleasure to have the opportunity to share my view about the impact of COVID-19 on China's healthcare systems. I'm from the CHIP Academy, that's a nonprofit healthcare think tank. I summarizing the China's healthcare trend post-COVID-19 into 10 major trends. So first, I give you a quick, brief picture about China's healthcare statistics. For the China healthcare expenditure per capita in the latest year, 2018, we reach about per person over 4,000 Chinese RMB. That's equal to about $600. So considering China have a huge population, we have a 1.4 billion population, so this is the average number. We also see the China healthcare expenditure as the percentage of GDP. From 2018, it reached to the 6.6%. So that's about average considering the China's economic status, 6.6. In the last 10 years, the increased healthcare expenditures developed pretty rapidly in China. Also look at the structure of the China healthcare financing. We have three major sources of the financing. So on the top one is the individual's personal out-of-pocket payments. In the latest time, it's still about 29%. The middle one is represent the social healthcare insurance expenditure. That's over 42%. On the bottom one is the government directly healthcare expenditure. So compare internationally, we look at the last over 10 years, the personal out-of-pocket payment gradually reduced. However, 30% compare internationally, we are still relatively too high. So because in the international experience, only in the individual out-of-pocket payment reach to under 20% will significantly reduce people's affordability problems. Okay, let's summarizing the 10 future trends of the China healthcare system after COVID-19. The first trend, it's about the public health and the preventive care versus medical care. So in my personal memory, because I work in the healthcare field about 30 years. So in my memory, we always emphasize the chronic care, the importance, the impact on the healthcare system. For a long time, we feel infectious disease already long time ago. It's already past, it's already over. So 17 years ago, China has the SARS. After SARS, Chinese government spent a lot of money to build up the labs, build up the CDC system, also spend money to have the reporting system, the infectious disease reporting system. So, however, after SARS, in the last 17 years, in China, we haven't had the major infectious disease. We don't have a major public health the problems. So people in our mind, we don't really pay too much attention to infectious disease anymore. So in the last 10 years, China has the latest healthcare reform after 2009. So last 10 years, government spent more money on the medical care, but we really don't pay attention to public health and preventive care. So this is give us a very important lessons. We need to really, after COVID-19, we need to really increase the government budget, increase the staff on the public health and preventive health. The problem is if we do better job on public health and preventive care, we feel that's become less important of public health because we don't see the problem, right? The medical care is different. You have more people go sick, have a disease, you feel medical care become more important. After COVID-19, we believe the people will pay much more attention to the public health, pay attention to infectious disease. So the important lessons, it's critical to transfer afterwards high cost management into beforehand low cost prevention. While it is important to put out fire at all costs, it's even more important to prevent a disasters from the beginning, right? If we do a good job, we have a good public health systems, have a good public preventional care, we reduce the risk to have this kind of big fire, okay? So while we have no doubt that we call the whole nation system can win the anti-COVID-19 war, we hope the public health system can prevent an epidemic outbreak coming back again. So because China in this time, in the beginning, the early year, China in the Wuhan and the Hubei, we see the outbreak of the COVID-19. We using the China called the centralized government, using the whole nation system, we quickly put out fires. That seems very successful, but we need to remember, we need a good public health care system to prevent this kind of fire happen again. The number two, the second trend, we believe that the primary and the community care will become more important compared to the tertiary medical care. The China healthcare system, we have the major problem. We have a tier 3, tier 2, and the community care, tier 1. For many years, Chinese people, they skip of the community care, skip the tier 2, they directly go to tier 3 hospital. So in China, we call the healthcare system is an inverse pyramid shapes. That means more people just pulling into the tier 3 hospitals. We will see the data. For example, in China, we have 30,000 hospitals. Tier 3 hospital, they only account to about 7% of the total 33,000 hospital. However, the tier 3 hospital, they account for about close to half the outpatient visits. They account for about 48% of total inpatient. So that's mean in China, tier 3 hospital, they will occupy about half of the total healthcare service. Let's look at the last 10-year data. Tier 3 hospital, the outpatient visits and inpatient discharge number, the increased speed more rapidly than tier 2, then tier 1, and another we call the undefined hospitals. So that's me in China in the last 10 years. Even government said the new healthcare reform, they want to increase the people using the primary care. However, we see the last 10 years, people still skip the primary care, go to the tier 3 hospital. So this is the problem happened in the Wuhan and the Hubei. In the beginning outbreak of the COVID-19, people don't go to the primary care hospital directly into a tier 3 hospital, create a problem, cross-infection, also create a problem we call the healthcare run-up. Right, so tier 3 hospital, their physician, nurse, they all become very scarce the resource. They also using all the hospital beds, using the ICU resource. So this is the problem that's have not happened in many other countries. Even look back, many other countries, they have more people affected. So because they do a good job on the primary care, using the primary care as the first line prevention. So for example, Singapore government, they are using the 800 primary care clinic as a first preventive kind of spots. People, if you have a problem, have some symptom, you first go to the doctor clinic to do a beginning screening. So in China, in the Wuhan, it's happened, all the people just pulling into the big hospital, so create a problem. So after COVID-19, Chinese government in China healthcare system will pay more attention to increased primary care. For example, in the city I lived in Shanghai, government created 200 we call the fever spots to as the first screening spots. If people have a problem, they were using this kind of spots as the first check. So we need to take a lesson to be prevent to have a what I call the inverse reflections because people maybe will get the wrong lessons. People in China, it's very easily thinking because the tier 3 public hospital and the centralized bureaucratic power, we're using that to win the COVID-19 wars. So these forces should be further strengthened. So I believe that's a wrong lessons, right? Because we look at back, we thinking the tier 3 hospital, they put out the fires. So we need to further need to consolidate, build up more tier 3 hospitals. So on the just opposite, we need to really increase the preventive care to using the preventive care to provide this kind of first-hand screening spots. So the number 3, so I summarize in the number 3 trend is the offline versus offline. So during the outbreak of the COVID-19, because a lot of hospitals closed the service, they don't accept the regular patients. So people have to use the internet-based medical care, have to use the we call the internet hospitals to get consulting, to meet a doctor online. So during last 6 months in China, also internet-based pharmacy start to be highly developed. Also, government social insurance start to allow people, if you receive the medical care online, receive the pharmacy online, they start to reimbursement this kind of online service. Before COVID-19 outbreak, so health government insurance don't allow to this kind of a reimbursement. So during the last 6 months, China, the online service start to be booming. I believe that's happening in many other countries. That's like we have the online conference, online working, online education. I believe after COVID-19, this kind of online medical care will become relatively more important. People in China, a lot of hospitals start to build up what we call the internet-based hospitals. So this is very important trend we need to pay attention to using more of online service. The number 4 trend I summarizing, it's called outpatient versus inpatient. It's like we see because of the closed hospital during the outbreak COVID-19, people have to using the out of hospital service. We using the community care, home care, day surgery, third-party independent service. It's like independent third-party screening, third-party imaging, third-party lab. So this kind of a service. Also, after COVID-19, I believe this kind of we will see the trend. People develop more out-of-hospital service. We could, in the reality, we see a lot of service we don't have to be provided inside the hospital. So this is the China healthcare system tend to highly rely on the hospital to provide all different kind of service. We see many countries have a more developed independent third-party service, also have a more clinical care. So in China, we believe after the COVID-19, this kind of outpatient move out of hospital will become an important trend. So for our company, with the future we're doing the business, we should pay attention to this trend. Maybe we should deal with more this kind of out hospital service. Also, number 5, future trends, I call the diagnosis versus treatment. During the period COVID-19, we see diagnosis become a very important tools because only if we have a correct diagnosis, we could find this kind of infect patient as soon as possible. So during the last 6 months, we see a lot of IVD business become highly developed. So diagnosis company, if they have a diagnostic business, they see a huge increase in the last 6 months. So even we see the COVID-19, maybe most people believe will become a long-term, this kind of will coexist with us more than probably 1 year. So we believe diagnosis business will become more and more important compared to the treatment. The number 6 trend we see I call the traditional Chinese medicine versus Western medicines. In China, in the Wuhan, the Hubei, during the outbreak, we see that in Chinese healthcare system, we're using the TCM to apply to the patient, almost all patients except for the most serious patient. People, if in ICU, we probably don't need a TCM. However, in China, we apply the TCM to the 90% patient. We also see they do have some kind of impact to reduce some kind of symptom, to really help COVID-19 affect patient, to help them to recover better than the people without the TCM. So in China, we see the government, also we see the people start to really use the TCM more and more. Also, we also see some kind of international, multinational pharmacy company in China. They start to interested in the Chinese medicine. We see a few companies, they do that also. The number 7 trend, I call the software versus hardware. The software, it's more on the HR, people's staff, medical resource, human resource, also information technology. In China, we have the long time tradition. People, government really pay attention to I call the hardware. Hardware means that we put a lot of money on the building, right? On the medical device, on the labs, on these kind of things. Concrete we could see, but we don't pay much attention to the soft things, to the people. So in China, in the long time, we have the problem, we spend too less money on the people, spend too much money on the infrastructures, probably because of the terms of the government employee, the terms of the hospital management. They have a 4 year term. During the 4 year, it's very easily if they spend money on the hardware, they will see their performance. If they spend money on the people, you not very easily to see the outcome in such kind of short time. So in China, the healthcare professional is a serious problem. Let's see some statistics. Here I select 10 countries with the most population in the world. We compare to the physician and the population ratio. Look at this number. China just happened in the middle of these 10 countries. We have the physician compared to 10,000 population. Look at this number, we're less compared to Russia and the U.S. However, compared to the India, another developing country, our Chinese number will be more than double than the India. So look at this number, seems okay. China, we have a less physician than country and more physician than the other country. However, let's look at the background, education background about the Chinese physicians. China have about over 3 million physicians. We see only a little bit over half of the Chinese physicians they receive the education 4 year college and above. We still have over 1 million physicians they receive the 2 year college, vocational school, high school, even under. So compared to the India, all the physicians they received higher education. So that's mean that in China, the education background of the doctors, it's not very qualified. So this is the problem why Chinese people, they skip the community care, even the tier 2 hospital, they directly go to the tier 3 hospital because people don't trust the physician there. So this is a problem for China. We need increased more qualified, more educated doctors. Okay. However, we look at another number. It's ironically, we have a huge shortage of qualified doctors in China. But on the other hand, we look at the last 40 years, we see every 10-year for period, we see compared to the first column, the second column is the medical school graduates within the 10-year. Okay, we look at the fourth period, the recent 10-year, we see we have 6 million graduates from the medical school. However, during the 10-year, we see another column, that's the increased physician during the same period. Increased physician only 1.4 million. Right, the ratio is the 4.5 million. So we have a more supply physician, we have a less increased physician. So that's me. A lot of qualified received medical school graduates. They didn't go to become a clinical doctors. They switched the job. They give up to be the doctors. So we see this is a huge problem in China. On the one hand, we have a huge shortage of the qualified doctor. On the other hand, we have medical school graduates. They don't want to be the clinical doctors. So this the problem that's indicated in China. We spend not enough money. We don't pay reasonable payment to the doctors. So doctor become a not very attractive jobs in China, right? So that's me. So after the COVID-19, this important lesson. We need a more educated doctor. We need a qualified doctor, qualified nurse, qualified ICU professionals, qualified ED doctors. So we need to spend more money on the medical staff, more money on the public health staffs. So let's look at the number 8 trend I call the private and public health care. In China, let's look at the number. In China, we have a total 33,000 hospitals in total. Private hospital right now increased very rapidly in the last 10 years. So among total hospital, about 2/3 they belong to the private hospital. Public hospital only about a little bit over 1/3. However, this hospital number, it's not a whole picture. Let's look at the beds, look at outpatient visits, look at the inpatient stay. Public hospital account to about 80%. So that's mean private hospital, even they have a more number of hospital, it's a private hospital. However, they occupy only about 20% of the healthcare service in China. Within the last 6 months, we see when we fighting COVID-19, Chinese using the public hospital as a major forces. So people will tend to get a conclusion. They feel private hospital it's not important in China because they doesn't really play some kind of role in fighting COVID-19. However, I'm thinking this also provide a case that's inverse reflection. Because in China, we still a lot of policy to not favor private sectors. They don't really compete fairly with public hospital on a lot of policy. For example, the insurance coverage, they have a lot of government research money. They cannot compete with public hospital to attract good doctors. So that doesn't mean private hospital is not important. We need to still play a more fair role to allow private sector to have a more room to develop. So in the future, when we're fighting with COVID-19, I believe if we have a good policies, private hospital, they should play a more important role than right now situations. Number nine trend, I call it's the consumption medicine versus serious medicine. Serious medicine, that's more traditional. We call we're using the doctors provide the serious medicine in the hospitals. Consumption medicine is more reflect some kind of consumption goods. They have a consumption goods feature. They also have a medical features. They tend to represent some kind of preventive care, some kind of, for example, nutrition, some kind of a counseling medicine, health management. Because during the COVID-19, people start to pay more and more attention to preventive care, to pay attention to, for example, facial masks. We have this kind of cleaning the waters, all these kind of things. So after COVID-19, this kind of we call the consumption medicine, they will become more and more important. If the company they have this kind of business, they provide the nutrition, provide the preventive, the medical goods, they will become more important. So the number 10 trend we call the peacetime versus wartime. That's the strategic medical supply system and the logistic. So this is a very important lessons we got, not only for China, probably for all country. We don't have a good prepare. For example, give an example, in Shanghai, we have more than 20 million population. That's a huge city. During the outbreak of the COVID-19 in Shanghai, the total storage of the facial masks at that time, it's only 300,000. However, in Shanghai, we have about 300 medical staffs. So that's mean the storage of facial masks only could use the one mask for one medical staff used one time. However, at that time, Hong Kong government have a storage of facial mask in Shanghai. It's called have a 50 million facial masks. They have a storage in Shanghai. Okay, so after COVID-19, the government pay a lot of attention. They need to prepare this kind of a medical supply, including the facial masks and this kind of cleaning medicine, nutrition, pharmacy, some kind of lab tests, device. All these kind of things become very important, and the logistic information systems. So we need to have a better preparation prepared, because COVID-19 probably will coexist for us for a long time. So we need to do a better preparations. Okay, let's make a final summarize. It's very important to make organizational and systematic change and improvement to reduce and avoid the consequence and impact of COVID-19. We need to make systematic changes, not only just change the one piece. We need a whole nation. We need to do a better preparation to prepare for the future infectious disease come back again. Also, we need a whole healthcare system to make a better preparation, to make better changes. After epidemic, people and the government will pay more attention to overall population health and the healthcare sectors. Healthcare will become a more important sector in the national economy. So because people will have a high conscientious about their personal health, about their family health. For the government, will pay a lot of attention, will spend more money on the healthcare sector. So for us, for people we work in the healthcare sector, we are very fortunately, right? Because many industry after COVID-19, they'll be affected seriously. Their growth rate will be reduced, even become negative. However, for pharmacy, for the medical health industry, we still see the booming. We see a lot of opportunities. So we need to really make a good preparation to help the healthcare system to do a better job. Thank you very much.